Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that are going to impact health IT. It's Tuesday News Day, and here's what we have on tap. Amazon joins the trend of sending workers away for healthcare. We have a Wall Street Journal article and a Modern Healthcare article. We're going to talk about why this is happening and how health systems should think about this trend. We're also going to take a look at what happens to customer satisfaction following a health IT merger and acquisition. We're going to, again, 12 some odd stories here. No way we're going to get to all of them. I'm actually wearing my glasses today because I've done so much reading this morning. A lot of really interesting things going on. Looking forward to getting to it. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance, yet many CIOs and health executives choose to go it alone. Technology has taken center stage for healthcare. Get a coach in your corner. Visit healthlyrics.com to schedule your free consultation. Let's just jump straight to the news. We have a lot of stuff going on the website. Want you to check it out. Insights, staff meeting. If you haven't signed up for that already, join the over 100 people who have already signed up for those. Pretty exciting response to it. I love making them and love your feedback on them. So let's get to the news. Amazon joins the trend for sending workers away for healthcare. Wall Street Journal article behind a paywall. One that was not behind a paywall. Amazon City of Hope partnership gives workers access to cancer support. I have them both linked in the section that will be on the website, so you can click on either of those stories. Let's see. What does it say? This partnership allows Amazon employees to request a review of their diagnosis and treatment plan from City of Hope specialists who may recommend improvements to the plan if appropriate. Amazon employees may also travel to City of Hope for an in-person evaluation, according to the Cancer Center's announcement on Tuesday. Workers can call the Cancer Center support line staffed by oncology nurses who will answer questions about treatment or provide emotional support. Though it's through its accountable precision oncology program, City of Hope said it will also support the care of patients with complex cancers by engaging their local oncologists to offer recommendations for genetic testing and targeted therapies and to accurately interpret test results. Here's a quote: "Cancer can affect anyone, no matter where they live, but not everyone lives geographically close to comprehensive cancer center that can give them the best chance for survival." Dr. Harlan Levine, City of Hope's president of strategy and business ventures, said in a statement, "We are always thinking about practical ways to provide best-in-class care, and we are excited to partner with Amazon on this important initiative designed to provide expertise to cancer patients and their treating physicians so that the right care is delivered at the right time in the patient's own communities." Important point. Amazon, which declined to comment beyond the press release, employs about 275,000 people in the U.S., which is a fair amount. "We believe that it's critical to provide our employees with comprehensive cancer care program, from real-time support to second opinions and treatment planning." Dane Sparman, Amazon's director of global benefits, said in an announcement. So why are they doing this? Well, first of all, it's a really good benefit. That's one of the reasons they're doing it. If my employer takes the time to negotiate this kind of an agreement, and think not a lot of these 275,000 employees, so we said 270,000 our employees are going to use this benefit, but if you're one of the ones that are going to use this benefit, it's a phenomenal benefit for you. So first of all, it's just a really good benefit. But the reason they're doing this, and the reason that others have done it, I'm just going to take you back 2 weeks to talking about this. About a month talking about this. There was an article about Mayo and Walmart's collaboration, and here's just a paragraph from the article that I shared almost a month ago. So, consider associates who received a diagnosis of cancer from their local medical providers. Of those who were approved by the Mayo Clinic, which is Walmart's Centers of Excellence for Cancer, to travel to Rochester, Minnesota for an evaluation, more than 10% learned that they, in fact, do not have cancer. That's staggering in and of itself, but it goes on from there. they receive a different diagnosis entirely, while 55% receive a different treatment plan. Some Walmart associates have learned that their cancer diagnosis was based on biopsies that were never completed at their local hospitals or medical groups, said Ms. Woods, who's in charge of their program at Walmart. And so one of the reasons that this is important is these centers of excellence are where the knowledge and the research are coalescing around. And because they're coalescing around there, you just have, just access to better resources. People who their sole focus is on cancer, and they have access to just funding, federal funding for research, and they're just doing some exciting things. And so by having this specialization, the theory is that you'll get better care at those locations, and in some ways the Walmart numbers would back that up. So what's, I've gotten away from this a little bit, I'll get back to it. So what's the so what for health IT? Remote health strategies to centers of excellence is really picking up steam for employer programs. I don't think this is an isolated incident. This is going to continue to pick up steam, and you're going to see this happen more and more, not just around cancer. You're going to see it happen in other areas as well. And the question I would ask from a strategy standpoint is, do you have programs within your health system that you think employers would find valuable, that you could be a center of excellence for a geography, a regional geography, or even a national geography? If you do, have you designed the technology foundation to deliver those services in a frictionless process to those remote patients? And there's a lot of different things. Obviously, the remote consults via video visits is important. The ability to do chat, do your call centers provide the ability to to route calls, to match that with incoming with the patient medical record? Do you have the ability to share that medical record and the information back if you're going to be a destination place back with the originating health system? These are just some of the technology foundations and platforms that need to be in place. And then finally, maybe not an IT thing, but from a health system standpoint, do you have the sales and marketing teams to position your programs effectively to those employers? One of the things I found is that most health systems have never had to sell before and have never had to market before. And because of that, they don't have the muscle. They have not worked that muscle too much in their organization. And because they haven't worked that muscle, they have to stand it up from scratch. They just don't know it. They just don't understand it. How do you sell to an employer program? How do you position yourself? How do you present and how do you partner correctly in those spaces? So there's a lot of things to consider, but this is a growing trend. Keep an eye on it. Next story. So what happens to customer satisfaction following a health IT M&A? Rajiv Leventhal, Healthcare Innovation Group. And this is, just to be clear, this is not healthcare M&A. This is health IT vendors merging and acquiring. So here's the gist of this. So a class report examines best practices on how vendors can avoid unhappy customers after merging and acquiring has taken place. How do mergers and acquisitions in the health IT vendor space impact these companies' customers going forward post-sale? So here's some of the key points. There's about 6 of them. Some of them are a little long. So first point, the research revealed that almost all M&As result in notable change in customer satisfaction. Not surprising. The odds of a customer will be left untouched are less than 20%. And the chances of satisfaction improving or declining is almost identical. It's actually 42-40. That it will either get better or get worse. This shows that the M&A activity is not inherently bad or good, but there are clear differentiators between companies who see improvement and those who see a decline, said class researchers who got the responses from 2,000 customers. So the next point, vendors who see a significant decrease in customer satisfaction in their first year typically take 3 to 5 years to recover, if they recover at all, the research noted. So that's important. If you're going to do an M&A, it's important to get the communication and those things right up front, or you're just wasting your money. Poor customer satisfaction in the wake of the merger and acquisition has a significant impact on customer retention, according to class. On average, the number of customers looking to leave their vendor doubles 1 year after a poor merger or acquisition. The top cited reasons are frequent nickel and diming, not a surprise, decline in the quality of phone and web support, and a stagnant product development cycle, which can happen. You bring two organizations together, they have to figure out how to come together, they have to figure out what standards they're going to use, what their principles around development are going to be. And so M&A slows things down within an organization because there's a lot of things to do. Next point, conversely, a strong merger and acquisition strengthens both customer loyalty and evangelism. This is because customers feel their vendor is aligned with their goals, cares about their success, and provides a sense of stability, the research revealed. So if you do it right, there's a significant upside. So these are 2 key points. So the 3 key best practices help drive M&A success are consistent pricing during the time of change, proactive communication to alleviate decision maker concerns, and prioritizing delivering value over delivering new functionality. So when you bring 2 organizations together, you're not all of a sudden starting a new development cycle and bringing out new products. That's just going to confuse things. You want to communicate very clearly with your clients. And one of the things I find interesting is that starts with your employees. Most times when these M&A, this activity happens, you talk to the employees and they don't understand it. And that just somehow falls through the gaps, and I have no idea how that happens, but that is critical. All right, let's go on to the next one. So when M&A go poorly, the 3 common themes that emerge are, according to the research, poor executive involvement, leading to poor problem resolution, overselling and overpromising, leading to unrealistic expectations. Also of note, the research found that the companies with healthcare-specific focus are more likely to see increases in customer sat after the merger and acquisition, since the companies often are aware of the level of communication, training, and hand-holding required within healthcare customers. Okay, so what? So why is this important? I think this is going to happen more often, and I think it's a good thing. I really do think it's a good thing. Health IT vendors we're exiting the heyday of health IT spending. MU really drove a ton of health IT spending, and we have just thrown a lot of money in this direction. The numbers for health system profitability is going to continue to be squeezed no matter who wins the election. It seems to be heading in that direction where everyone agrees that the cost of healthcare needs to come down. And so there's going to be public pressure to come down. There's going to be pressure from the payers. Not only that, once that pressure starts to happening, health systems start to spend less money, become more discerning buyers, and they are becoming more discerning buyers. I'm finding that more and more as I talk to people. The other thing that's going to happen is you're going to have private equity, which has backed a lot of these health IT vendors as they try to scale up. They're not going to be happy with the returns, and they're going to look for exits, and exits leads to M&A activity. And again, this is a good thing. We have a lot of poorly run companies and bad solutions within healthcare IT. We could actually use a purge right now, to be honest with you. Second thing I will say is 1 plus 1 rarely equals 2 and almost never equals 3. I hear people say all the, this is a 1 plus 1 is going to equal 3 kind of situation. Consolidation of vendors, let's just take one simple thing. It never leads to lower prices. I know sometimes you'll hear somebody say, yeah, we're going to be able to, we're going to bring these 2 contracts together and you're going to spend less. Almost never the case. If they came together on the financials of them charging you for both solutions, they're going to figure out a way to get the same amount of money, if not more, from you. I have my economics degree, and there's almost no graph that shows fewer suppliers of goods leads to lower prices. It always leads to higher prices. Less competition leads to higher prices. So when they say that your costs are going to go down, they're likely lying at worst and misinformed at best. I'll skip the last thing, but at the end of the day, what can you do? So what's the so what? And I'm not going to give you my so what. I'm going to give you Sue Shade's so what. So Sue Shade, and this hit another article, 12 tips for effective vendor management, and I'm going to force you to read the blog post and not give you a ton of detail on it. I'm just going to give you the 12 things. It's a really solid article from someone who has managed a lot of vendor contracts, and you should take a look at it. So when these 2 things come together, or any vendor contract, these are the things you should be looking for. You should be looking at the product roadmap. They should be able to articulate, we brought these 2 organizations together, we believe we're going to bring out these products or bring these products together in this way. They should have a good vendor roadmap. They should be more service oriented than sales oriented. How are they helping you to do your job and helping you to be more effective? They should be able to talk about TCO. How are they helping you to hit your goals? How are they helping you to reduce the cost of healthcare, to remove friction, to make it a better experience all around for your providers and your patients? Fourth thing, reputation. Check the references. If they did M&A and you're not familiar with the other company, see if you can get references for that other company before you start bringing their product in. I'm sure you already do that. Good, solid advice. Solid contracts are your friend. Spend the time there. Know your contracts. Know what they say. And, I had in our health system, and now we did about $200 million a year. I had a person dedicated to contracts, both on the financial side and on the legal side. And I had a person dedicated within IT to just managing those contracts. When you're spending around $200 million a year, that's a lot of money. And you want to make sure that your contracts say what you need them to say, and they're not cookie cutter. We've read enough of them. They're just you're going to be able to get different things from different people. The sixth thing: are they focused on implementation? Have they been successful in implementing within healthcare? Seventh thing: escalation. Can you get to the right people when you need to? And that is critical. I talked to a CIO who is working through that right now with one of his vendors. Getting the escalation right within those companies is important. Excellent customer service, effective account management, executive level relationship. Make sure you can talk to that executive when you need to. Long-term value value for the investment, and support for your mergers and acquisitions. So this is the thing I'm telling people now to make sure is in their contracts. Try to spell it out today. What does M&A look like? If you are the acquiring company, you should be able to dictate based on your current contract how much more you're going to spend as you add to your contract. So, this is great. Sushades articles on Sushade.com. Check it out and let her know that I referenced it. In fact, I just recorded a podcast with her and David Muntz on the same show, talking through some things. Phenomenal episode. I'll air that in a couple weeks and share that with you on one of the Friday episodes. Let's see. I want to get to two more stories, so I'm going to move through this pretty quick. So the future of healthcare at Walmart includes root canals next to the garden rakes. MedCity News, Sheila Mulrooney Eldred. And this is a follow-up from 2 weeks ago. So when a man in his 40s went to get a toothache checked out recently, the dentist immediately realized his pain wasn't due to his teeth. The dentist put the patient in a 3D CAT scan and showed horrific sinus infection. So the dentist called over the primary care doctor. While the pair discussed the patient, the man mentioned his vision was also a little off. Could this be due to the sinus infection as well? Probably not. But the dentist and doctor agreed and walked the man over to the optician who prescribed bifocals. The bill for the man with the toothache, dentist, primary care, optician visit, a third of the traditional costs. Slavinsky, Sean Slavinsky, president of health and wellness for Walmart, said every patient has the option to pay through insurance or cash on the spot. An appointment that may cost a total of $60 to $70 through insurance would cost $20 in cash. And this is just a follow-up from a couple of weeks ago. What is Walmart's strategy going to look like? And Sean Slavinsky says, we hope that this integration would occur, and it is. So far, it hasn't been hard. He goes on to say, so far it hasn't been hard to recruit medical professionals to rural locations. Dallas is about 45 minutes outside of Atlanta. We've had hundreds of people applying, he said. They're hungry for something different. Many got into the business to provide care, and the fact that they got to come and practice in a holistic way, it's like a field day for them. Since it opened next to the Walmart's Garden Center, the health center has averaged over 100 visits a day, about triple the expectations, Slavinsky said. In addition to the full dental care, primary care, and optical care, each health center will have full laboratory, imaging services, pharmacy, and audiology, and behavioral health counseling. The next piece, Slavinsky said, will be to take advantage of the company's trucking system, the largest in the country, to offer mobile services. Trucks will travel from store to store to offer specialty services that can be targeted to the needs of the individual communities, such as dialysis and mammography. Wow. That's what Walmart's doing. And The only reason I came back to the story is to say it looks like it's coming together. They have some initial feedback. I think it's worth keeping an eye on. It's definitely worth keeping an eye on. But if this doesn't sound like a national healthcare company, I don't know what does. And yes, it's only one location, but this is exactly how Walmart made their name. They started rural, and they gobbled up everything rural, and then they moved into the city, and they said, well, it'll never work in the city, and it appears to have worked in the city. So keep an eye on this. This is exciting. If you're in a health system, ask yourself, how do we compete with this? And when are we going to have to compete with this? These are good questions. I am past 20 minutes, so let's just say news stories in 25 minutes or less. So here we go. Our last story, how blockchain can help improve patient identity matching and consent. Healthcare IT News, Mike Milliard. During Converge to Accelerate, hosted by Blockchain in Healthcare Today and Telehealth and Medicine Today at the HIMSS Connected Health Conference, a discussion went on with DirectTrust CEO Scott Stewie, Stuewe, Stewie, and Haven Health CEO Vincent Albanese. And I'm sharing this story, first of all, because I like to talk about this. I think it's one of the core issues when we talk about interoperability is this patient ID thing. And as you know, this is something I'm pretty passionate about. And I think this national patient ID is a red herring. I think it's just a bad direction. And so I wanted to lay this out because I think it's interesting because I think he captures the challenge pretty succinctly. So let me go into this. So patient matching is a problem of trying to get artifacts. Stewie laid out the four big problems that we have yet to solve fundamentally: patient matching, identity, consent, and tension between what is called mass centralization and mass synchronization. And by the way, I think that's brilliant to capture that all in one sentence. Patient matching is the problem of trying to get artifacts in care to match up, ensuring that data produced in two different settings are in sync. Additionally, you have this problem of duplication, where at an individual institution, frequently up to 20% of the records are duplicates. That's a high number. But anyway, he said, but I think of that as an identity problem. The question of identity is still a fundamental issue. I'm not saying it's not high, but it's 20% would be a really poorly run HIM department. It should, it should be in the single digits. Sometimes it ticks up. If you do M&A, you have some challenges and those things, but 20% is extremely high. As for consent, that's an even thornier issue. It's straightforward for treatment between the providers as long as the data is not sensitive in any way, Stewie explained. But if the substance abuse treatment or behavioral health, all that data actually needs to have different consents in different states, which is a complex problem. And I agree, and it is. And with the fourth challenge, the friction between centralization and synchronization. If I'm going to centralize everything, if I've got one system and everybody is on that one platform, I only have to get that system to work, he said. Actually, that didn't make sense. And with the fourth challenge, the friction between centralization and synchronization, if I'm going to centralize everything, if I've got one system and everybody is on one platform, I only have to get that system to work, he said. If, on the other hand, I've got lots and lots of systems probing, I'm going to have to get all those systems to synchronize. And the more of those systems there are, the harder the synchronization problem is. The tension remains in our world and is actually codified in TEFCA, which is basically set up the tension by saying that there will be a relatively small number of highly centralized organizations that will nonetheless synchronize between each other for the purpose of patient identification. To get past this, he said, the fundamental issue is to grapple with the solution that might actually start with the identity problem. So if we actually build a system that was built on the notion that identity was at the source, that could go a long way towards solving the patient matching issue. Let's get it right in the start, said Stewie. Let's identify the proof of people when they show up, wherever they show up, but then also issue them a credential that can be utilized in various settings. So he goes on to talk about the thing. So what? This captures the crux of the issue really well. Mass centralization versus mass synchronization. And, you know, it's interesting. To me, the solution is obvious. I believe it is a mass synchronization with data standards being pushed out federally, and then mass synchronization with the patient being the locus of the identity and of the medical record, to be honest with you. So, and if you look at how we design systems within health systems, we have 400 distinct applications in just about the average health system, and 75% of those applications have something that refers to the patient. But we don't create one single database and look at all the vendors and say, hey, look, you all have to use this one database. That would be crazy. We would never do that. It would never work. What we do is we create points of integration, and we figure out how to synchronize those things across those 400 applications and attribute the right data to the right patient. And we do that all the time within our four walls. And when we go outside the four walls, we think all of a sudden we're going to get to a mass, not mass synchronization, what did he call it? A mass centralization solution. And it doesn't make any sense. It's easier to think about. It's easier to get your arms around, and it might be easier to solve if it was easy to solve. But it's a complex, nuanced problem, and I think it requires mass synchronization. I think blockchain and Ledger is an interesting platform with which to address this. So why did I cover it? I think it's an interesting use of blockchain. National Patient ID remains, to me, St. Elmo's fire of healthcare, and this one sentence really did capture it pretty well. 4 big problems: patient matching, identity, consent, and tension between what is called mass centralization and mass synchronization. Well, that's all for this week. Don't forget every Friday to check out our interviews with industry influencers. Keep the comments coming. Bill at thisweekinhealthit.com. Good, bad, or indifferent. It really does all help. And if you want to support the fastest growing podcast in the health IT space, 5 ways you can do that. Subscribe on YouTube, iTunes, Google Play, Spotify. Follow our social accounts, interact and repost our content. Subscribe to the newsletter, This Week Health Insights, or staff meeting on the website. And, just tell your friends what they're missing. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com. YouTube channel you can get through thisweekhealth.com, or just go to YouTube and search for This Week in Health IT. Thanks for listening. That's all for now.